Is pregnancy after IVF actually different, or is that just a myth? Do IVF pregnancies need extra care, more scans, more restrictions, more bed rest? And once you finally see those two lines after such a long journey, how do you stop worrying about every little thing? Hi, I'm Dr. Spandana, your OBGYN. And today let's talk about pregnancy after IVF, what is truly different, what is not, and what every couple should actually know. And most importantly, how to enjoy the pregnancy instead of living in constant fear. First, let's clear up the biggest misconception. An IVF pregnancy is still a pregnancy. The embryo may have been formed in a lab, but once it implants inside the uterus, the pregnancy grows the same way as any other pregnancy. Your body does not treat the baby differently because conception happened through IVF. But IVF pregnancies are often monitored more closely. Why? Because many couples undergoing IVF may already have factors that can make pregnancy slightly higher risk, like age, PCOS, endometriosis, fibroids, hormonal issues, previous miscarriages, male factor infertility, or years of infertility itself. So sometimes it's not IVF alone that changes the pregnancy journey. It's also the reason IVF was needed in the first place. But to understand why IVF pregnancies are monitored a little more closely, we also have to look at the whole journey. Even before pregnancy begins, your body goes through ovarian stimulation, frequent injections, scans, and egg retrieval procedures. These steps can carry small risks like ovarian hyperstimulation syndrome, temporary bleeding, infection, or enlarged ovaries. And by the time pregnancy happens, you've already overcome so much physically and emotionally. And we also cannot ignore the emotional side of IVF. Hormones, repeated procedures, waiting, uncertainty, financial pressure, and fear of failure can take a huge mental toll. Many couples feel emotionally exhausted even before pregnancy begins. Now, once pregnancy happens, what changes? In IVF pregnancies, early scans are often done more frequently. Doctors usually monitor beta-HCG levels, early growth scans, heartbeat confirmation, and overall pregnancy progress closely. Most women who conceive through IVF are also given progesterone support during the early weeks of pregnancy to help support implantation and early pregnancy development. And these medicines should never be stopped without medical advice. Even if genetic testing was done on the embryos before transfer, standard first trimester pregnancy screening tests are still strongly recommended during pregnancy. These scans and blood tests help make sure the baby's development is progressing normally. Another important topic is twins and multiple pregnancies. If more than one embryo is transferred, the chance of twins or triplets increases. And carrying multiple babies places extra stress on the mother's body. This can increase the risk of preterm labor, hospitalization, anemia, high blood pressure, and delivery complications. Does IVF increase pregnancy complications? Some complications are seen slightly more often in IVF pregnancies. For example, there can be a higher risk of high blood pressure and preeclampsia during pregnancy. Because of this, some women may be advised low-dose aspirin during pregnancy depending on their individual risk factors. But this should only be started if your doctor recommends it. IVF pregnancies can also have slightly higher chances of gestational diabetes, placental problems, preterm birth, and cesarean delivery. Placental issues like placenta previa, where the placenta lies low, or placental abruption, where the placenta separates early, are also seen slightly more frequently. There is also a small increased risk of ectopic pregnancy, where the embryo implants outside the uterus. But remember, having a higher risk does not mean these complications will definitely happen. Many IVF pregnancies progress completely normally and result in healthy mothers and healthy babies. Another big question: do IVF pregnancies always need bed rest? No, routine bed rest is usually not recommended in a healthy IVF pregnancy. In fact, gentle movement and staying active are usually better for circulation, energy levels, and overall recovery. Unless there's a specific medical concern, complete bed rest is generally avoided. What about exercise? Most women can continue safe, gentle exercise during pregnancy if medically allowed. Pregnancy after IVF does not automatically mean complete physical restriction. What about miscarriage risk? Miscarriage risk is often more strongly linked to age, embryo quality, and underlying medical factors rather than IVF itself. And once a healthy heartbeat is seen, that is usually a very reassuring sign. One thing that truly feels different in IVF pregnancy is the emotional journey. The positive test, the first scan, hearing the heartbeat, and feeling the first kick. For many couples, these moments come after years of waiting, disappointment, injections, surgeries, and hope. So it's completely natural to feel extra protective or anxious. But try not to let fear steal the joy of the pregnancy. IVF pregnancy is not automatically a fragile pregnancy. It simply deserves proper medical care, emotional support, and regular follow-up. What about delivery? IVF does not automatically mean cesarean section. A normal vaginal delivery is possible if mother and baby are doing well. The mode of delivery depends on factors like baby position, twins, placenta, previous surgeries, labor progress, and overall safety. What about the baby? Most IVF babies are born healthy. The vast majority grow, learn, and develop normally. Some risks may be slightly increased statistically, but many times this is related to factors like twins, maternal age, or underlying medical conditions rather than IVF alone. In some IVF pregnancies, doctors may recommend additional monitoring of the baby's well-being during the final weeks, especially if there are other risk factors present. This does not automatically mean something is wrong. It's simply a way of keeping both mother and baby safe. And finally, mental health. Women who conceive through IVF often carry silent anxiety throughout pregnancy. Sometimes they are afraid to celebrate too early. Sometimes they keep expecting bad news. Please don't ignore these feelings. Talk openly with your doctor, partner, family, or counselor if needed. Emotional care is also pregnancy care. And here's the truth every IVF mother deserves to hear. Your pregnancy is real. Your emotions are valid. And you deserve to enjoy this journey too. If you conceived through IVF, what has been the most emotional part of your journey so far? Share your experience in the comments. Your story might comfort another couple silently going through the same path. For more doctor-explained videos on pregnancy, fertility, IVF, and women's health, subscribe and stay connected. Always consult your doctor for personal advice. Thanks for watching.